Hey everyone, in this video we will be going over delegating, prioritizing, and the importance of time management.
Welcome to CASRN, where I teach you about all things nursing.
All right, quick introduction. We will be going over time management and how important that is. And inside that, how prioritizing and delegating can help you make the most of your time. So the reality of the situation is that 99% of the time there's a lot to do and you need help getting it done. Often it seems impossible when the day starts, but if you use some of these techniques, then it can help you get through it in a little bit easier. So time management, I'm telling you right now, it's really hard, especially right now with everything that's going on with the pandemic and the nursing shortage. The best thing that you can do is organize and plan your time. So first off, you need to make sure that you're anticipating the day's activities and creating a checklist. After shift report, I like to take 10 to 15 minutes and write down the tasks that I need to accomplish before the end of the day. So I've created my own report sheet that's pertinent to the things that I do on my job, and I've divided that into those categories that were the most important, such as assessments, labs, medications, testing that needs to get done, any new orders, patient goals, communication with the doctors, and things like that. And then I create a checklist of those tasks and assessments that need to be completed. So I personally like to focus on the hard things first, because then they're over and I don't have to worry about them again. There's a book I read once, it's all about procrastination. It's called Eat That Frog. If you ever have a chance to read that, it's kind of a funny spin on getting the hardest things done. But essentially saying, like, every day if you have to eat a live frog, you're going to dread it all day long, knowing that you have to do it eventually. But if you just get up and do it first thing in the morning, then the hardest thing is over and you just don't have to worry about it anymore. It's got a great psychological effect and it lifts that heavy weight off of your shoulders. So I highly recommend taking that and implementing that into your nursing care. Get the hard thing over with first, the thing that you really don't want to do, and then the rest of the day is going to be a lot easier because that's not just hanging over your head. So focus on those big and difficult tasks first. And then, of course, prioritize and delegate. Prioritize the things that are going to affect your patient the most. And I've got other videos that talk about prioritizing that you can go ahead and look into, and then delegate what you can. So first off, we're going to cover prioritizing. So starting with the nursing process is really going to help you in deciding what needs to be prioritized. So go in and assess, diagnose, plan, implement, and evaluate, and then review your ABCs. So you've got, and then you've got your Maslow's hierarchy of needs, you've got sick or not sick, and then you've got organ vitality. So I've linked one of my videos below that you can look into and understand a little bit more about what prioritizing needs to look like. Then when it comes to delegating, this can be really confusing. When I was going into nursing school, I wasn't entirely sure on what could and couldn't be delegated, but I found a way to kind of simplify that in that you are still responsible for the outcome of that care. So you need to make sure that you're going to delegate it to somebody that you can trust to get it done. Now, the idea here is that you have the right task, the right circumstance, the right person, the right communication, and the right supervision or evaluation. So when you think about asking someone to do something for you, but you're ultimately still responsible for that task and outcome, makes you think a little bit harder on what you would ask someone to do. Are you going to ask a CNA to do a lab draw? Or are you going to ask a phlebotomist to help a patient to the bathroom? Like, what if they fell when that phlebotomist was helping them? A phlebotomist doesn't have training on how to help a patient move. So make sure that whatever task you're asking someone to do, that you follow the 5 rights. Ensure that the right task is delegated in the right circumstance to the person with the proper understanding, experience, and or training. And then make sure that you adequately communicate what you need done, and then make sure that you follow up to ensure that it got done correctly. So as far as the legal side of delegation, you need to refer to the Nurse Practice Act for your state, and I've linked to that below as well. So let's go into this a little bit more. This is a generalized list of do's and don'ts. So remember that every state is a little bit different and that you need to check your local area to know for sure what can and cannot be delegated. But if you're looking just to pass the NCLEX, these kinds of questions have to be generalized because the NCLEX is for the entire United States. So we've got a UAP, which is an unlicensed assistant personnel. They can only do non-invasive things. So this is going to be like ADLs, which is activities of daily living. This is going to be helping brush teeth, helping in the shower, helping get dressed, helping to eat, and then maybe some range of motion exercises, depending on the restrictions of your patient. And then we've got an LPN, which is a licensed practical nurse, or an LVN, which is a licensed vocational nurse, and they can do some invasive procedures. So they can help with catheters, urinary catheters. They can help with wound care. They can give medications that are by mouth or by injection, and then they can review education. However, they cannot educate. They can only review education. And then you as the RN, you do the education, which can be reviewed by the LPN. And then you do the assessment, you do the planning, and you do IV medications. All right, quick review. Time management is really important because time can fly by, especially when you have multiple patients that you're taking care of. So do your best to stay ahead of everything that's going on and plan your day so that you're able to accomplish those things that you need to get done. Inside that, you need to prioritize certain things such as medications and assessment, MD communications, and any kind of treatments. You may often need to ask for help because that's just where things go. And so that's where delegation is going to come in. But remember that you need to know your local laws. However, it's still your responsibility. So make sure to delegate appropriately.
Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.